Hi, I'm Paul Conrad, physiotherapist in the West Hill Physio Clinic, and today's video is on how to manage an episode of low back pain. The purpose of this video was off the background of sending a post out on our Facebook page, and a couple of people commented on our post as we was asking what people would like to know about. Was there any exercises, advice, or a particular topic that people wanted to know about, and people were asking about how to manage low back pain. So first thing to talk about is what to do when you have low back pain, what kind of exercises can you be doing, when would it be appropriate to perhaps go and see your GP, and perhaps when would it be appropriate to seek advice from a physiotherapist to help you with your back pain. So the first thing just to touch on is back pain in itself, just to offer some words of reassurance really. Back pain is probably one of the most common things that people will present with, certainly here at the clinic, or will be one of the most common reasons or musculoskeletal reasons why somebody might go and see their GP. So the first thing to say is that we can largely categorise low back pain into two categories. So the first one being called non-specific back pain, and the second one being specific back pain. So when we talk about non-specific back pain, this is really what we mean by there's no real underlying pathology going on, there's nothing sinister going on, there's no serious medical issue going on, and this would equate to nearly all low back pain. So probably greater than 95% of people out there who have an episode of low back pain would fit into this non-specific back pain category. And it would normally be that you perhaps moved in a slightly awkward way, and the likelihood at most is the most common reason for your pain would be something like a pulled muscle, where you pulled a ligament in your back, something along those lines. Those who present with a specific back pain, as I said, there's something probably more pathological going on, so there might be some sort of systemic inflammatory disease going on, there may be a malignancy or a tumour, so it could be something cancerous, there could be disc prolapse, something along those lines that's pushing onto nerve, which is causing the back pain complaint, or could be down to a trauma, so a fracture in the back or something like that. But again, just to reassure you that that would probably be less than 5% of all low back pain. So the majority of you, the vast majority of you, there is nothing seriously going on, so just if you follow some of the advice I've given in this video, you should make a full recovery from your back and be absolutely fine. So it's worth just saying at this point that if you do have back pain and you do experience worsening symptoms, and when I say worsening symptoms, I don't just mean pain generally, but also neurological symptoms, so worsening pain going down the legs with pins, needles, numbness, loss of sensation in your bladder and bowels, so you may find that if you are finding that you're needing to go to the toilet, or there's an urgency to go, or you have loss of control over your bladder and bowel, unsteadiness in your gait, loss of muscle power in your legs and coordination, that is more of a medical emergency. You do need to go and get that checked out. So if you're not sure and you're getting those kind of things, that's the time to go and see your GP, or that's the time to go and see your other primary care providers, such as accident emergency service or something of that nature. Otherwise, just because you're in pain, that doesn't necessitate the need to go and see your GP if you just follow these simple advice. So what's the first thing you want to do is low back pain, or let's say this non-specific low back pain, most of these will get better all by themselves within about 4 to 6 weeks. So the first thing that we advocate is try and keep moving. So long gone are the days now where you want to take to bed rest and not move. So the current evidence suggests that if we can try and keep moving, and we can try and keep exercising within your capabilities, that really is the best way to make a quick recovery from your back pain complaint. Now, a lot of patients come into the clinic and sometimes they are in quite high levels of pain, and that is stopping them from trying to move and exercise. And so at that point, that is when it's appropriate to sort of talk about pain control and pain management. I say pain could be a real limiting factor in you trying to move forwards and get better. So a lot of the guidelines would suggest that taking some painkillers or non-steroidal anti-inflammatory drugs can be quite useful in the short term to try and help you get over this barrier pain so that you can actually move forwards and get moving again. And at this point it'd be quite useful to seek advice from someone like a pharmacist, so they may be able to give you something over the counter to help control your pain. If what you're taking from over the counter or from the advice of your pharmacist isn't helping you, either the pain is still quite strong and that's stopping you moving, then again that might be appropriate to go and have a chat with your GP and see if there's something that they can offer that might be slightly stronger, again just to help you moving. So as I said, most of these back pains, the underlying cause is probably some sort of strain in either the muscles or the connective tissues or the ligaments. It doesn't warrant further investigation, so don't panic, don't feel like you've got to go and see your GP and start demanding, requesting x-rays and scans, because they're not really useful at this point in time. And having some form of scan, the findings that are shown on a scan can, more often than not, are quite normal. So it's worth just saying that there was a really good study where they did MRI scans on people from the age of sort of 20 up to 80 years old, and all of these people had no back pains, had no symptoms whatsoever. And a lot of these scans came back with disc bulges and joint degeneration and degenerative disc disease and all these kind of things, and they were completely normal findings. So it's what you'd expect to occur with age, but it had nothing to do with these people because they had no pain at all. So you don't want to be going and having scans if you've got an acute episode of low back pain, because it's just not helpful, and the likelihood is anything that's shown on the scan isn't the reason why you've got back pain. What we want to do is get your pain under control. That's where medication comes in, and we want to try and get you moving again. So the next thing that brings me on to next wise is what type of exercises can we do? As I said, the exercises have got to be quite gentle. They're primarily just to try and encourage the body to start moving. And it's important that we do try and encourage some exercise quite early on, because this is going to reduce stiffness, it's going to improve your mobility, and overall start to help get your function back again. Don't do these exercises if, of course, you are having spasms in your back, so you're trying to do a particular movement and your muscles are going into spasm. That's really means that these exercises aren't appropriate at this stage. But it's worth saying that just a little bit of discomfort, if it's manageable, is okay, and it's perfectly safe to do this. But as I said, this is a general exercises, a general video. So just do what you can within your capability and try and keep moving. So I'm going to go through some exercises, and we'll see how we go with that, and then obviously we'll talk about when it would be appropriate to see a physio. So the first exercise we can do it's just some back stretches, back mobility exercises, just to reduce some stiffness and try to improve your mobility and function after having a low back complaint. So the first exercise I'm going to just give you is one called a knee roll. So if I just lie onto my back, so you can actually do these on the bed if you want, or just pop yourself on the floor to get yourself comfortable. So first one, just a little knee roll. It's going to lie on your back, just with your knees bent, place your arms just behind your head. Okay, and I'm just going to very gently take your knees to one side. I'm just going to hold that for about 10 seconds. Okay, and then just gently come back to the centre, and then we're going to take that back the other way. So it's just providing a little bit of rotation and gentle stretch through the tissues in the lower back as we come back up again. Again, just to reiterate, if you're having any increased pain with these exercises, or if you're noticing any muscle spasms, then it's not appropriate to try and do these at this point in time. Second exercise is just a nice stretch. That's just a knees to chest exercise. Just take one knee, bring up towards your chest, and then slowly back again, and then repeat to the other side. Again, just a nice number, about 10 reps is sufficient, just to get things moving. Okay, exercise number 3 I've written down here is just some prone extensions. So what we're looking to do here is just to lie onto your front. And all we're going to try and do, again, within your pain tolerance, is just to try and get a little bit of gentle extension in the spine. So I'm just trying to gently push up onto your elbows and then back down again. Again, only go as far as you feel comfortable. So if you can only tolerate just a little bit, that's fine. If you can tolerate sort of propping yourself up a little bit further, that's fine. And again, just about 10 reps is sufficient, just to try and help get a bit more extension back into the spine. Once you've done that one, I'm going to give you a cat stretch. So this is the next one I get people to do, because it actually improves mobility above and below perhaps where your back pain complaint would be. So if if you've got pain, it does change how we move, and we can get quite stiff in other areas of our body. So we want to try and get all areas of our body moving. So this kind of helps sort of promote more movement through the entire spine. So cat stretch, we're going to get to this 4-point kneeling position. So my knees are just gently underneath my hips, my wrists directly underneath my shoulders, and we're just going to gently lift the back up. So it's like a cat stretching, and I'm going to try and sink back down again to just get a little bit more extension back into the spine. And again, back up again. So just really take your time with this, and just try and get these little movements going. So predominantly you'll feel sort of a nice sort of stretch coming through here. Once you've done that, we can then just gently start taking your bottom back towards your heels. Again, this is just a nice lower back stretch as we do here, but it also promotes a little bit of hip movement again. So sometimes the hips can get quite stiff when we've not been moving particularly well, or we've been a little bit immobile because our pain has stopped us moving. So again, just 10 reps, just bring ourselves back down this way. And then once you've done that, what we want to do is just get a bit more of an upper thoracic stretch. So we're just going to walk your fingers along the floor and then just gently push the chest down towards the floor. And then slowly back up again. Okay, and then just gently down. And back up again. While you're in this position next, we can then just do some reach lunges just to encourage a little bit for more rotation into the body. And it will also, in this position, start to get some muscle activity back, which then can actually start to support your back and your tissues as well. So just in this position, just going to take one hand, just going to gently reach underneath you, and slowly back again. Again, just go 10 times this way, and then go 10 times the other way. Just like that. And then once you finish doing those, again, just bring yourself back down to this position once more, just to have a little stretch. And then just while you're there, what you can actually start doing is just walk your hands over. So actually just stretching out the left side of my back in this position. Briefly hold and then come back again. And of course then we go over the other way. And so you should feel stretched just down the outside of your body here. The idea of those exercises, after you've done them, you should find that your body feels a little bit more mobile. You should notice perhaps you've got a little bit more range of movement. Hopefully you feel a little bit less stiff. Again, that's conducive to getting your function back. And as you start to feel a bit more comfortable, again, you just want to start increasing your exercise tolerance. So obviously we're trying to promote exercise. So a little bit like walking, that's a pretty good start if you can do that. Or for those of you who are used to exercising, trying to get back to what your normal routine is. So the quicker you can get back to your normal daily activities, the better. One of the things that we say we don't do is go for a prolonged bed rest anymore. If your back is obviously going into spasm and you're in a lot of pain, then obviously sometimes you do need to take to bed just for a day or two, but we don't really want to be looking to stay in bed much longer than that. Because it's really say once you get moving, that really is what tends to turn the corner. So these type of exercises you should you definitely get a lot better within a couple of weeks. Just notice that the pain's starting to come down. I said most low back pain complaints with this type of advice, getting your pain under control, trying to get moving, do some gentle stretches and try to carry on with your normal activities. Will get better within sort of 4 to 6 week period. If things really aren't getting a lot better, that's when we suggest it might be worth just going to have a chat with your GP. Perhaps it might be appropriate at this time for your GP to refer you to a physiotherapist. Really what we would do at this time is try and understand what is preventing you from moving forwards, what is stopping you being able to improve your range of movement, and what we'd probably actually offer at this point in time is some form of sort of manual therapy with exercise, just to try and get your joints moving a little better and help you get back to your function again. If you're one of those people who also has had several episodes of back pain, so most people we're all susceptible to getting some form of back pain at one point or stage in our lives. But if you've noticed that you've within quite a short period you keep having regular occurrences or reoccurrences of back pain, again, that's probably a good time to go and see a physiotherapist. We can take a history from you, we can look at how you move, we can test your strength, look at your flexibility, look at your joint mobility, we can talk about what sort of active lifestyles you've got or what sort of adaptations perhaps you could change in your lifestyle. So we can actually start to understand why you are having these problems with your back, and we can actually start to put some sort of exercise program together for you to try and get your body to rehabilitate and start to help you get your life and function back. So that's it from me for this video anyway. I hope you found it useful. try and keep moving, as I said, that's the main point. Get your pain under control, and hopefully that will get you back to where you need to be very, very quickly. So don't forget to like and share our page, because the more comments that we get, the more videos we can put out, the more information we can help you with. Our Facebook page is facebook.com/WestHillPhysio. Our website is www.westhillphysio.co.uk. We're also active on Twitter and Instagram. And thank you for watching, and hopefully we'll see you in the next video.